Talk to Mark Meredith about what he is hearing from that statement and beyond, possibly. Mark, what do you have?
Hey, Bill, good morning to you. Well, we've talked about the main headline here, but this is also something that the White House has been preparing for ever since the president took office. And this was something they knew was certainly going to be a possibility. I want to give you a sense of what it's been like when you go into a room with the president of the United States these days, because there are still precautions that are being taken. So if you're members of what's known as the pool, which is a group of reporters that go into either the Oval Office, the State Dining Room, all sorts of different events, they have to be tested in order to get access into that room beforehand. So they want to make sure that anybody that could be coming into contact with the president would not be COVID positive. You mentioned the event that happened last week when the president was on the South Lawn. That was an outdoor event. Yes, there were so many people. There are hundreds and hundreds of people there to talk about gun violence, but the event was outside, and the president has made it clear that he believes that these outdoor events were going to be safe. The White House itself has even relaxed a lot of its COVID policies compared to where we were a year ago. I remember in summer of 2021, when you would come on this campus, either it was a ghost town because nobody was here, or the people that you would run into, they would be double masked. And as cases continue to go down, and obviously the severity of the symptoms have gone down with the vaccinations, we have seen those restrictions get laxed. Even where we are in the press area, it's pretty rare to see a mask these days. Remember those briefings we saw where all of the reporters would be spaced out, everybody would have to be masked, you couldn't even be in there if you weren't wearing a mask. That has all been gone. So the majority of those COVID policies have been lifted. But I saw just yesterday when the president was going up to Massachusetts on Marine One, all of the staff that was following behind him, they were wearing masks, which I thought was interesting because they were getting on the chopper. I even saw the press secretary put on her mask right before going on to Marine One. The president wasn't wearing his when he went on there, but certainly an indication that they were still taking precautions with the president. You talked about just the travel he did last week. Obviously, with an international trip, the stakes were going to be high. They wanted to make sure they tested him beforehand, but the president was not getting tested on a daily basis. That simply wasn't happening. We would even ask, reporters would ask, hey, when was the last time the president would get tested? And the White House would have to get back to us, so they had to check with those records. So we know it wasn't necessarily on a daily basis. Let's also talk about how this is going to impact the schedule going forward. The president was set to go up to Pennsylvania, Scranton area later today to talk about how he's going to combat crime. He was going to be spending the weekend at his home in Wilmington, Delaware. Now it says the White House that he's going to be isolating here. So it's already going to be shifting the schedule a little bit. There was also some interesting moments earlier in the week, and it could be pure coincidence, that Monday and Tuesday he didn't hold any public events. And there were some questions as to what was he doing behind the scenes. The White House said he was still hard at work, holding a lot of meetings. Obviously, the president felt well enough to travel just yesterday. So we're looking to see whether or not the schedule was already changed once because of any potential early sign of those symptoms. But the White House simply saying that the president has very mild symptoms right now. They also point to his vaccination status as well as his boosting status. They want to make it clear that they believe those people that have the vaccines, that they are going to be okay. This is a message we've heard from the White House before, even when those numbers of COVID cases went up earlier, Bill.
Just one question for me, Mark. What you're saying is that there was not a daily protocol for him getting a test. And what you're saying is that that did not change even with the travel overseas.
Well, he was tested before he went overseas. Right. We know that. But in terms of what was happening in the last, say, a month ago, he wasn't getting tested on a daily basis. Because, again, reporters, we would ask, when was the last time the president got tested? And the White House would have to get back to us and say, oh, let me check and get back to you. Whereas if it was a daily basis, they'd say he was checked every day.
I think you can start to track down the timeline here. I mean, the last statement in the White House press release here is that the president's last previous test for COVID was Tuesday when he had a negative test result. He was obviously traveling and delivering that speech yesterday afternoon. So sometime between yesterday afternoon when he flew back to Washington and now was the positive test. So this could be the very beginning stages of his positivity. And by the way, according to what they say he's going to do, work in isolation till he tests negative, that goes way above and beyond, even as the White House statement notes, CDC protocol as it is today.
Well, luckily the White House is a big place, so he's going to have plenty of room to spread out. In fact, I was just looking to see, I don't see a Marine at the West Wing door right now, so an indication that the president would be in the residence at this moment. He did get back yesterday afternoon. I know he spoke to some reporters after he got Air Force One, and then he was back at the White House, I want to say around 6 p.m., 5 p.m. yesterday, so he got back at a fairly decent hour. But Sandra, you are asking about another really important point here is going to be the contact tracing, because this is also really interesting. Let's say, just heaven forbid, if I I were to test positive when I came to the White House, they would ask me, when was the last time that I saw the president? So that would be something that would come up. The White House medical office would try to signal when anybody who has been COVID positive came into contact with the president or a high-level official. So they wanted to work backwards. And in this case, obviously, they're going to try to do a little bit of contact tracing to find out whether this came from somebody in senior staff, somebody he maybe met with and who's in Massachusetts. I know there was members of the Massachusetts congressional delegation with the president yesterday. I believe it was Senator Markey and Senator Warren were also traveling with them. We'll have to wonder if they have to isolate now. Obviously, there's going to be a lot of scrutiny on how the White House may react to this. But there's been so many questions about what this would mean for President Biden, given his age. And obviously, right now, the White House saying that he's experiencing mild symptoms and they're going to continue to monitor, but that the president is still working from here.
Mark, thank you, Mark. Stand by a moment here. We got some doctors coming up to our audience at home, so be patient with us. They'll be on in a few minutes. I know you're not a doctor. I wish you were, because I got a question about the medical protocol for something like this. I want to bring in Brett Berrigan on this. There will be a briefing Thursday afternoon, we're told. And Ashish Jha, the doctor who's in charge of the COVID-19 response coordinator of the White House, he will be there. He was with Harvard, he went to Brown, and now he's at the White House. He was a great source of information for us during the early days of the pandemic. Brett, I wonder, and the doctors can answer this for us in a minute here, given his age, given the vulnerability when you're fist bumping or shaking hands or breathing the same air of others overseas in rooms where you're not sure whether or not they have the virus, whether they could be infected or not, whether they were tested or not. It would seem that, given the stakes, how high they are, that a daily test would be reasonable, in my view.
Right. And listen, the president is in that age, that is in the vulnerable age group. He is, according to the statement, taking Paxlovid, which is an oral antiviral pill created by Pfizer. It is designed to treat COVID-19 in the early days. If you test positive, you take this pill, 3 pills twice a day for 5 days. And it is, according to the tests that they've done on it, 89% effective of keeping people out of the hospital or getting very sick. Add to that the president's been twice vaccinated and twice boosted. He's got a lot of vaccination, and now the Paxlovid as well. We didn't hear a lot about the antivirals in the fighting of COVID, but now a lot of experts, and you'll talk to these doctors, think that this is a game changer and may be for the president if he's only experiencing mild symptoms.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.